We know that cardiovascular disease is the leading cause of death worldwide. We know that reducing cholesterol makes a lot of difference for the patients, but we also know that it's not only that. And there have been many epidemiological studies, many genetic studies, and sub-studies of the big intervention trials that we reduce LDL intensively, and we still see a lot of patients having myocardial infarction, strokes, and dying, even considering intensive LDL cholesterol lowering. So that's why we have to deal with this issue of the residual risk. There's this epidemics of obesity in emerging countries, and this is associated not only with a greater risk of diabetes and insulin resistance, but also the consequences of that, right? And one of the consequences of obesity and insulin resistance actually is atherogenic dyslipidemia. So we have elevations in VLDL, lipoproteins, so we have an increment in its remnants, and consequently also we have low HDL. And these lipoproteins, they are atherogenic because they not only carry triglycerides, but also they carry cholesterol, and cholesterol in these particles is pro-atherogenic. These lipoproteins, they are pro-inflammatory, and they are pro-thrombotic. So with the big epidemics of obesity in the world, and especially in developing regions, we have a big number of individuals who suffer from this kind of metabolic defects. And consequently, these individuals, they run a higher risk of cardiovascular disease, even if we treat their LDL cholesterol in an adequate fashion.